latest innovations in liposuction and facial surgery utilize lasers. Joining us to fill us into the details is plastic surgeon Robert Gotkin of the Cosmetique Center in Greenvale. Welcome.
Thank you, Doug.
Liposuction, just for the uninitiated, just explain what that means real briefly.
Liposuction is the removal of fat by suctioning it out like a vacuum cleaner would remove dirt from your floor. And we use little, almost like straw,
doesn't look very little, Bob, I gotta be honest.
Like this, and we introduce it in and remove the fat.
How deep under the skin are you going?
Right under the skin, where the fatty layer is, under, just immediately under the skin.
And is that where fat is, right underneath the skin?
Yes, that's where it is.
We were looking at the procedure there on the video. Not painful at all?
Oh, there is some discomfort with it, but we've come a long way from where we were even 10 years ago. There's something called the tumescent technique, and that's a way of introducing local anesthesia so that you don't even need general anesthesia to undergo the procedure. And now we're even using ultrasound to melt the fat, and we're removing the fat as a liquid now. How
long a procedure? I mean, obviously, I guess it depends on the extent of what you're having done, but how long can it be?
It can be from a half an hour, or it could be to several hours, depending on which areas we're doing and how much fat needs to be removed. But we can safely remove fairly large volumes now.
Is it expensive, Bob?
It can be. It usually runs from several $1,000s to on up, depending on the areas that need to be treated.
Who would you recommend it for, and is there certain folks that you would not recommend this for?
Sure. It's not for the massively obese individual, but it's for people who are at or close to what they would consider their ideal weight, with localized areas of fatty excess.
What are the common areas? I guess around the stomach there?
Well, in men, it's the abdomen and what we refer to as our love handles, and in women, it's the hips and the thighs.
Are you finding more men getting involved in this, or what's the percentage breakdown?
Absolutely. Well, I think the percentage is still about 70-30 women, but I think that's considerably up for men than what it used to be, and more men now are coming as they reach that middle age and they start to get a little excess here. They come and they want that done, and their love handles too, and they just do absolutely great.
Bob, just before you were telling me about another procedure where you don't go under the skin. What was that again, and how does that work?
It's called endermology. Endermology is a non-invasive technique where there's a rolling motion with non-invasive suction over the skin. No
piercing the skin at all?
No piercing the skin, and it seems to improve the appearance of cellulite, so it's very popular with women now.
Okay, very interesting.
Thank you.
Thanks very much for joining us, Bob.
Sure.
Stay with us, a lot more ahead for you here on News 12.